I welcome everybody who has joined for this meeting, all the veterinarians and even enthusiastic farmers and paravets. So this is the third topic of the series. Third topic of the series, continuous veterinary education series initiated by Mahavet. So this is a national CB initiated by Mahavet on the refreshing the knowledge of basic animal nutrition, especially ruminant reproduction. So today, sir is going to talk on the infectious causes of the repeat breeding and their therapeutic management. So I once again I am thankful of respected Markande sir for guiding us. I request sir to start the session. Also, I am thankful of the media partner Jio Gau Samruddhi who has supported us for this meeting. Even their team, Mr. Gibran, Mr. Gajanan, for providing their valuable time and support. Thank you. Then I request respected sir to start today's session.
Thank you, Dr. Vaksurajit. Very good evening to all. This is the third session organized by Maharashtra State Gazetted Veterinarians Association along with the Jio Samruddhi as a media partner. Friends, last time we have discussed in length about the non-infectious repeat breeding condition, and I have also spared my PPTs. The post session link will be definitely available to you all. The last part, it was uncovered, and that was regarding the embryonic mortality after, say, 30 days of insemination. So in this case, the only solution we have is the progesterone, and we have to take care of uterine environment, nutrition of the animal. So this was the last part which was remaining last time because of the connectivity. Today, our topic is most important because 7 out of 10, every 10 cases are infectious repeat breeder animals. And infections are very difficult to handle because regularly we are using antibiotics. Response to the antibiotics is questionable, and farmer breeders are frustrated due to this type of repeat breeding problem, infectious repeat breeding problem. Problem is common in cows and buffaloes. This particular problem, even if it is treated, even if it is cured, still fertility is reduced by 20% in case of dairy animals. After recovery, animal is having healthy type of reproductive system after treatment, but still fertility potential efficacy is reduced by 20%. And culls, regularly we are culling the animals which are below the average, that is called as the culls. Auction, that is by 3%. 3% culls, 20% reduction in the fertility. These are all economically related type of the things, and therefore the topic is most important one. Friends, infectious repeat breeding is being handled since last many years, but it is equally true that there is no perfect solution till date to handle every case with 80% and above efficacy. Every time causes are different, every time situation is different, and we are facing such a type of cases under field conditions. Had there been no infectious infertility in case of animals, we would have reached our target of national milk production long back, but we will have to struggle with this particular condition. It is very important to note that repeat breeding is a condition where animal is repeating with turbid type of discharges. Discharge is a turbid one, discharge is passive one, and discharge is regularly voided out, which is not transparent. This condition is expensive. This condition is a localized type of condition. This is also important that it is only limited to uterus, endometrium. Total genitalia is not affected, but the part which is affected is most important for us because this particular part has to carry the conception and embryo. So friends, please remember that always this particular condition has this type of limitations. Failure of dairy animals to eliminate the infection before 21 days of parturition, that is the major problem. And if infection remains inside the uterus, this particular animal suffers repeat breeding problem when it resumes the cyclicity. So we have to note this particular condition, what type of condition it is. And most important thing is that it is the inflammation of secretory part. Endometrium is a secretory layer, and that particular part is inflamed. This is very important one. So endometritis, subclinical endometritis, clinical endometritis, they are leading to a repeat breeding problem in case of dairy animals. You must have discussed very many conditions in veterinary practice with different type of approaches. What is the definition? What is the incidence? What are the causes? What is etiology? What is pathogenesis? What is the line of diagnosis? How to treat these conditions? And prevention is always a small part. Regularly, this particular part is neglected when we are discussing any type of condition. Friends, considering the economic value of this particular condition, treatment we will discuss. But we should know prevention. We have to extend preventive strategies to the farmer breeder. Unless we extend these type of strategies to the farmer breeder, it is impossible to reduce the incidence of repeat breeding. And therefore, our idea regarding preventive approaches for repeat breeding is most important. In my life, I have tried to prepare detailed notes on each and every reproductive activity or disorder for preventive approaches. Let there be torsion, let there be prolapse, let there be any type of unstressed condition, but we should know preventive type of approaches. If we prevent it, we will not face it. So that is the consideration. Therefore, first 2 to 3 slides, please remember that this end topics are the prime important topics for repeat breeding. Now, what is important? Number 1, prepartum immunity level must be high in case of dairy animals. So when animal enters in the advanced stage of gestation, it is important that immunity should be high, and we should prepare animal for strong immunity. Vitamin E, selenium, vitamin A, minerals we are providing during the advanced pregnancy. Positively, we should monitor for strong immunity level before parturition. It should not have a lower level of immunity, number 1. Number 2, when animal is going to parturate, every parturition must be clean and hygienic. In democratic India, extension has importance under field condition, and therefore clean parturition, hygienic parturition, disinfectants, use of disinfectant at the time of parturition is very, very important. Next, postpartum care and the treatment. Every animal needs treatment. Please remember, every normally parturating animal also requires some treatment after parturition. This very much important because infections are common and entry of infection is common immediately after postpartum. because of the loose type of labia, loose type of genital passage, open cervix. Then also there is a immunosuppression, immunity level is lowered, animal is under stress, and these factors they contribute for infection, susceptibility to the infection. Friends, animal must have clean body, very, very important, clean body and clean hairs. After parturition, for 15 days, animal must be clean. So that is most important. Another important thing is that positive energy is necessary after parturition. Even if there is a negative energy balance, we should make this animal very strong as per the provision of concentrates is considered, proteins is considered. Vitamin E and selenium should also continue in the postpartum phase because we are interested to suppress the infection immediately as soon as possible. For rectal checkups, once animal is parturited, 3 rectal examinations are necessary. Number 1, the first examination by day 5th to monitor collapsing of uterine bag, the bag which was gravid, that should collapse. This is number 1. Day 15th to check cervical closure, that is also important. And by day 30th, we know that in case of cows and buffaloes, approximately by day 30th, we can evaluate complete involution of the uterus. So this type of follow-up. Next important thing is that cytological investigation of discharge by 21st day. Very, very important. This is very important. This has diagnostic value. This will indicate that genital discharge is free from the infection or it has low level of infection. Cytological studies of this discharge by day 21st is necessary. Another important thing, very rarely it is pointed out that animals should not have liquid feces. Liquid feces will spread the infection. It will spread this infection through soiling of the floorings. Sufficiently pasty feces which will not spread, that is important, and negative energy balance, these are important type of the things. Monitoring postpartum phase is very important. For first 15 days, it is necessary for a veterinarian to observe the animal once, twice, thrice from front side and from back side, from the rear side. The front side will indicate attitude of the animal, appetite of the animal, ears, eyes, and alertness of the animal. This is not directly related as far as the parturition is considered. But when we go back or toward the rear side, friends, output we can check, and particularly genital output, what type of discharge is going on. We have to check temperature. Every time temperature is necessary, we are going to discuss it. Udder feel, whether udder is proper filled or not. Tail carriage, now there should not be elevation of the tail. Tail should be all normal, resting on the pelvic floor, that is the ischial arch. This is all important for observations, external observations of the animal. And temperature recording for first 15 days by the animal owner will reduce the chances of infection. Whether there is a fever or whether there is no fever, these are the 2 clear-cut sets. If there is a fever, friends, discharge, whether it is a discharge and that type of discharge has a fetid type of smell, fever and the fetid discharge requires antibiotic therapy. Fever with discharge which has no smell requires checkup for mastitis, metritis, and pneumonia. This is first set. Second set is no fever. Animal is not showing any type of fever. But discharge is fetid one. No fever, but there is a discharge. There is a reduced type of appetite. Here, chances of metabolic diseases, ketosis, hypocalcemia, the chances are more. And therefore, this condition is also important. If there is no discharge, if the discharge is less and also there is no smell, appetite is normal, we are through. This particular condition has no issues. and therefore this will reduce the chances of infectious repeat breeding in future. Infectious repeat breeding. Now nothing will happen, animal will not die because of this uterine infection. Please remember, no uterine infection will lead to death of the animal, but economic death of the farmer is more important. Always remember that performance as uterine infection, it is reducing milk yield and also it is contaminating the milk with the antibiotic residues. We don't want it. We don't want it. And therefore, from day first of parturition up to day 15th, it is mandatory for every veterinarian to suggest. I know, I was also a field veterinarian. I know that your suggestions may not be acceptable to the farmer breeders because of the cost. But unless farmer invests for this particular treatment cost, he will not be through for repeat breeding problem. And therefore, what is necessary? Number one, placental expulsion must be before 6 hours. And this particular placental expulsion must be monitored by preventive dose of Icbolix 15 days prior to the parturition. Again, I repeat, many veterinarians may not accept, but please accept drenching of Icbolix 15 days before parturition leads to degeneration of placenta, separation of placenta, and prompt expulsion of placenta within 6 hours of parturition. And therefore, first bottle of Icbolix before 15 days, and we know that we are drenching it for 3 days. The next important thing is that estrogens and prostaglandins are necessary in case of those crossbred animals, those buffaloes, where the body weights are more than 500 kg. The bag itself is of 50 kg, 60 kg, 70 kg. There is a necessity to collapse this particular bag, and collapsing of the bag is only possible in case of cows and buffaloes if we are stimulating uterine contractions with the help of low dose of estrogen, small dose, 2 to 3 ml, that much is sufficient to collapse the bag. The next one, we can go for prostaglandins from 4th day to 6th day, luteolytic action and further myometrial contractions, they will lead to collapsing of the bag. But if bag collapses early, chances of entry of infection and flourishment of infection are less. The next one is infusions. Every parturited animal requires compensation of blood volume through dextrose normal saline. That will also provide strength to the animal. If there is any blood loss, that will compensate the volume. Painkillers, anti-inflammatory drugs, very, very important. Parturition is the only physiological process which is accompanied by the pain. And if we want to relieve the pain, we will have to give painkillers. Maybe orally by bolus, through bolus. Next one, the tonics, energizer. Animal is in the negative energy balance. Energy is required, proteins are required, concentrates are required, and therefore ample and rational feeding of concentrates, energizer, that is important. Antiseptic are very, very important. Clean the surroundings, surface, everything, and make it sterile, sterilized. Then only infection will stop. Potassium permanganate is available. It is the cheapest type of the source for disinfection, but no one is using this as antiseptics after parturition. I know many dairy farmers who have never reduced the stock of potassium permanganate from their farm. And there is no case of repeat breeding on such a type of farms. If anybody is in question regarding this particular point, I will give you the name and also the phone number of that person who has not evidenced any case of repeat breeding on his farm. He is regularly using potassium permanganate 1%. That is important. Use disinfectants, use minerals, use stress relievers, use galactogogues. Milk yield we have to increase. Uterine restoratives for 6 days. Same type of Icbolix which we have used 15 days before, that one should use it. milk let down regulators. That is also important. And last one is that fomentation, where there is a swelling, where there is a pain, that rear side, pelvic side needs fomentation, rope thrush in case of chances of prolapse, and very clean type of hygienic type of parturations are expected. This will reduce definitely the incidence of repeat bleeding by 75%. Because in case of cows, that is crossbred cows and HF cows, incidence is 20% to 50%. In buffaloes, it is 40% to 75%. What is the percentage of infection? And it is only because of illiteracy of the farmers. And we are there to prevent this type of condition. So friends, this is also important. Infectious repeat bleeding, the next one. Next slide, please. Right. Now, what it indicates, immediately after parturition, up to 10 days, there are chances of puerperal metritis. Puerperal metritis. Metritis will develop, and that infection is called as puerperal metritis. It is a pus in the uterus. Clinical metritis from 11th day to 20th day. Very simple to understand. Initially puerperal metritis, then it is followed by clinical metritis. The third stage is starting for clinical endometritis. Clinically, we can check this particular incidence of infection, that is clinical endometritis. Once it becomes subclinical, it becomes very difficult to diagnose clinically from day 40 onwards. And then if the pyometra sets in, it is a closed circuit pyometra. What type of infection we come across in case of infectious repeat bleeding? It is a mixed infection. Friends, please remember, everything is available in the genital tract. Genital tract is a panorama of infection. It is a museum of microorganisms. Mixed type of infection with gram positive, gram negative, aerobic, anaerobic type of organisms. And therefore, these organisms are habitual or habitant organisms in the reproductive tract. Subclinical endometritis, that will lead to cervicitis, vaginitis, and also it will lead to compromised immune status of the animal. This is very important, friends. This will lead to compromised immune status. Clinical signs are absent generally, but animal repeats, and therefore, per rectal examination, if we perform, we may not get anything on the unless and until on the day of estrus, because that is the day where we are getting in the turbid type of the discharge. When animal comes to postpartum estrus, my professional brothers and sisters, please remember, this first postpartum estrus is not fit for artificial insemination. It is not at all fit for artificial insemination, because this particular estrus is meant for investigation. And what is to be investigated? It is to be investigated whether that this particular estrus is a clean estrus. There is no infection in the uterus, that we have to investigate. When animal comes into the estrus, this animal should show continuous increment in the body weight in the next 21 days, from first postpartum estrus to next estrus, subsequent estrus. 3 body weight measurements, they should indicate increment in the body weight, number 1. Number 2, how much is the duration of the estrus, because that particular duration will be helpful for recognizing exact time of insemination when we are going to inseminate this animal next time. And the last one, the discharge, which is very important. If it is a turbid one, it indicates that last time when animal parturited, there was a proper care by the animal owner, and now there is no problem as far as the infection is considered. This transparent discharge is indicating that you go for insemination in the next cycle, the first subsequent estrus, and you will find the pregnancy. So remember, never be confident about antibiotics and antiseptics which you are using in the clinics, costing 100 rupees to 1600 rupees per vial. Unnecessary use of antibiotics, antiseptics is not necessary in case of infection. Prevention of infection is most important, and hygiene and sanitization, these are the preventive measures. So friends, please remember that we have to go for all types of preventive approaches to avoid this particular condition through hygiene and sanitation. We have already seen last time when we have differentiated infectious and non-infectious type of repeat bleeding problem. Here I have intentionally put this slide only because discharge, genital discharge, estrual discharge is always a turbid in case of infectious repeat bleeder animals. You will find very clean discharge followed by some whitish part at the fag end of the discharge. You will find hairy type of infection in the discharge. Very few small white foci in the discharge, but that particular discharge is clear-cut indicative of turbidity and whiteness, and therefore this is a case of, we can diagnose at least that it is a case of infectious type of discharge. Second one, pH. pH is always more acidic and more alkaline. More acidic. You will find 5.5, 5.8. You may find 7.8. So this is only because of the infection. And pH, many veterinarians, they carry pH paper in their pockets to check mastitis, to check this type of discharge, whether there is subclinical endometritis. Metricheck score, it indicates that if we take out the genital discharge, which is outside the cervix, we can score it. This particular discharge definitely will have some or other type of turbidity, whiteness, change in the color. It is not at all transparent. Therefore, the grades are 1, 2, 3. 0 grade is meant for transparent type of the discharge. White side test, very simple. Anyone can attempt this particular test under field condition. Sodium hydroxide solution, 5%. And the discharge, cervical discharge, uterine discharge, vaginal discharge, whatever discharge you are able to suck it from the genitalia, put it with the sodium hydroxide solution, boil it for a minute or two. If this white precipitate becomes yellowish, it is a mild type of infection. If it is something yellowish, you can consider as a moderate type of infection. And if it is a turmeric type of yellowness, it is a severe type of infection with the animal, or that is the uterine infection. Polymorphonuclear cells, these are the neutrophils. So this nucleus itself is polymorphic. And if such a type of cell count is evaluated, then you will find the particular case as a repeat bleeder. So friends, on 20th day, when there is a chance of clinical type of endometritis, then neutrophil count must be less than 18%. From 35 days to 50 days, the neutrophil count must be less than 10%. And when animals are in estrus or regular cyclicity, the discharge should not have more than 5% neutrophils. If the neutrophil count is more than this, every chance to have infection, and particularly endometrial type of infection. So these cells you can very well observe under the microscope, and you can identify the infection in case of repeat bleeder animals. Of course, culture sensitivity test, you can send the samples for culture and sensitivity. This facility is not available. No farmer breeder will demand for laboratory diagnosis of the samples. He will not ask for laboratory establishment for diagnosis, but he will ask for milk rates. Thanks to the Indian system, that people, they are not aware about their benefits. Where they will get benefit, it is the diagnostic type of facility. Milk rates will not provide any type of stability or their economic status to them. But if no animal suffers infectious repeat breeding condition, definitely they will gain maximum as compared to the milk rates. And therefore, please remember that this particular test is very important, and one should insist for evaluation, cytological evaluation of the contents. Stress color, consistency we have to check, odor we can check, and then we can put metri check score. There should not be any foul type of smelling. There should not be any type of odor. Consistency and color. These are the two important things. We have to compare this with normal transparent color and the tensile strength of the estual mucus. Vaginal swabs we can have, the sterilized swab we can use, or also cytobrush is available in the market. You can use this cytobrush for, and also we can go for the culture and sensitivity test. So the ring, that is more important, and this particular test provides suggestive information. It is not perfect information. It is not a perfect, it is a suggestive type of, you can go for this type of antibiotic, you can go for that type of antibiotic. This is all what we are getting from culture and sensitive test. But definitely the laboratory examination, if we complete properly, we can have a direction for attempting the treatment. Uterus is such an organ, is a wonderful organ, that it is an incubator. It is moist, dark, warm, sterile, and therefore all infections they prefer to live inside the uterus. Best Taj Mahal. It is a bacterial Taj Mahal. They don't want to come out. And therefore, please remember that always some or other type of infection is there. There is a multiplication of infection. Slowly it is getting settled because of the reproductive phase, because of the steroids, because of change in the reproductive cyclicity. And once again, there is recontamination. So infection followed by subsiding of the infection, and then once again recontamination. These are the phases of subclinical endometritis. Mixed infections are more common. Whatever the number of bacteria are there, they always produce the infection with friends. It is not a single isolated type of infection. If we consider uterus after parturition, single organism will cause puerperial metritis. But in case of subclinical endometritis and when animal is cyclic, it is not a single infection. It is a group of it is a group of positive agents. They are leading to the infection and repeat breeding problem. See, if the antibiotic is resistant, then you will not find any type of zone. And if the size of the zone is 10 millimeters and less than 10 millimeters, it is the less sensitive type of antibiotic. Highly sensitive indicates 20 millimeter and more type of zone formation with the antibiotic disc, and that type of antibiotic we can prefer for the treatment of the animal. So this culture and sensitivity examination is supportive, suggestive, but it is not conclusive. Please remember, it is not conclusive. It is supportive. So we have to go as per our logics and as per our experience, the type of infection prevalent in that particular area. It is uterine infections or the endometrial infections are not related with the bacteria. They are also related with the viruses, fungi, protozoa, mycoplasma. So everything is there. It is impossible to treat viruses with that of the antibiotics, but all other things we can treat with that of the antibiotics. This is also true for protozoans. Some protozoans we can treat with antibiotics, but not all. And therefore, we will have to delete viruses and protozoal infections, that those are not to be treated by the antibiotics. But fungal, mycoplasmal, and bacterial infections we can very well treat with the antibiotics. The type of organisms you will find that actinomycetes, pyogens, Klebsiella, Corynebacterium, E. coli, Streptococcus, Staphylococcus, and so on. I have given very small list. This list is unending. This list is unending, and maximum number of infections, organisms, they prevail in the tract. Important thing is that when animal is under stress, there is infection. When animal is very healthy, strong, immune status of the animal is strong, no infection will be there. Even if these organisms, they are inhibitant in the external genitalia or in the reproductive tract. Now, these type of infections, when we say that it is aerobic, anaerobic, gram positive, gram negative, and it is a mixture of 3-4 type of organisms, it is important to note that not a single specific pathogen is responsible for subclinical endometritis. Oh, definitely it is responsible for puerperal type of metritis, but not for subclinical endometritis. Number 2, these are opportunistic organisms. As we said, that whenever animal is under stress, infection will be there, and therefore these organisms, the non-specific organisms, are called as wound invaders, opportunistic organisms. Those are the environmental infections. It is not that only those are available in the vaginal passage. No. Those are available in the shades, cow byres, everywhere in the universe, and these are the environmental type of infections. These are influenced by perpetuating or predisposing type of causes. Whenever animal is suffering from some or other type of stress, maybe a biochemical deficiency, maybe metabolic disorder, maybe thermo irregulation, these type of things can lead to infection. This infection is limited to an individual animal. Very, very important. On a farm, if 2 cows are repeat breeders and infectious repeat breeders, it is not necessary that both they are suffering from the same type of infection. Not at all. One cow will have a different type of organisms causing the subclinical endometritis. Another cow will have another group of organisms causing subclinical endometritis. And therefore, subclinical endometritis, we will have to concentrate as an individual problem and not as a herd problem. This is very, very important. If it is a herd problem, then we will have to think for vibriosis, campylobacteriosis. That is a different issue. If maximum number of cows are repeating for a period of 6 months, 8 months, and thereafter they are getting settled, the chances of campylobacteriosis are more. But subclinical endometritis is individual animal-oriented problem. The next one, lateral or horizontal transmissions are more common. So infection will go from environment through the genitalia as ascending type of infection. Many type of infections, they are limiting, or those are stopped, inhibited by the body itself. It is possible that body will limit this type of infection. It is not that every type of organism can go for causing the subclinical endometritis. No. If the body has strong immunity, that particular infection will be stopped. The next one is that these infections, they will not cause severe type of genital infections or severe type of conditions in the genitalia. Burning sensation, reddening, continuous discharge, these things will not be there. Only on the day of the stress, there is a type of small discharge, fetid discharge, quantity is turbid one, and then animal fails to conceive, but that's all. Otherwise, there is no severity of this infection. No temperature to the animal. Animal is all normal, healthy. Leads to contamination, elimination, and repeated contamination that we have already discussed. And condition is related to immunity that occurs naturally or does not arise from the previous infection or vaccination. This is also important. But overall effect of this infection is that they reduce the reproductive efficacy in case of the animals, and therefore we have to concentrate on corrective measures of this infectious problem. Now, the pathogenic organisms are important because they are causing endometrial infection. This is number one. Endometrial inflammation they cause. They are toxins, they lead to inflammatory condition in the endometrium, and therefore very important thing is that we should not consider only infection. We will have to consider endometrial inflammation also in case of infectious repeat breeding. Number two, they are removing total mucosa. Denudation of mucosa is taking place under the effect of infection. Uterine secretions are increased, and in case of cows, glandularity is a problem. Regularly, cow will show some or other type of discharge, but when animal is suffering from infection, the discharge quantity will increase. Alteration in the uterine environment, that is possible because pH will change, uterine milk contents they will change, and also the uterine environment will change, which will not be conducive for conception, for implantation, for maternal recognition of the pregnancy, and there are n number of problems in the uterus. Bacterial organisms, they produce toxins that we know, and many times the local type of hormones or histaminic type of substances are released. Those are also creating irritation and the problems. Continuous straining, septicemia and pyemia, these are the worst type of condition. If closed cervix pyometra continues, in that case animal will not repeat, but it will continue with the continuous type of infectious discharge, what it discharge. Of course, endometrial tissue damages are more in case of non-specific type of infections. Friends, fertility is interfered. It is reduced by killing the gametes or the conceptus, by changing the uterine milk composition, by inflammatory condition, and by histological changes, which are chronic, long term. They will take too much recovery time for making the endometrium healthy, velvety, and acceptable for the conceptus. Even if there is such a type of infectious course, etiology, and the pathogenesis, body has its strong defense mechanism, and this defense mechanism is most important to cure all type of uterine pathological conditions or uterine infectious condition. Friends, it is not the antibiotics, it is not the treatment, it is not our approach, it is not our skill which helps to make the animal pregnant, but always prime importance must be given to the body defense mechanism. The body has its own defense mechanism. Nature has created a very strong reproductive system in case of the animals. There are physical barriers. The physical barrier is with vaginal mucosa, vestibular mucosa. There are anterior and posterior vaginal sphincters. These sphincters, they will not allow the infection to travel in the ascending manner. This is the physical barrier. Number two, columnar epithelium of vaginal lining is responsible for secretory activity, and these secretions, they are continuously draining out the contents from vaginal passage outside. This is another type of physical barrier. Cervix is such a strong organ where there are rings. It is not a single ring, but there are 3, 4, 5 rings. 3 to 5 rings in case of cows, 4 rings in case of buffaloes, and these rings will not allow entry of the infection. Physical barrier. The second one, which is most important one, is the functional barrier, and functional barrier is because of the phagocytosis. Phagocytosis, there are fighter cells in the blood, and these cells, they are fighting against the infection. More and more blood flow toward the uterus during estrous stage is absolutely important for inhibiting the infection. This is number one by phagocytosis. Number two, secretory activity. Immunoglobulins, IgA, IgM, IgG, all these things are secreted by the reproductive system, by the external genitalia, by the uterus, and therefore there is a limitation of infection. Vaginal secretions, they carry lactoferrins, and they are inhibiting the infections. This is also important one. Uterus is having contractibility during estrus because uterus is under the effect of estrogens. These contractions that leads to expulsion, voiding of the discharges, that is also important, and therefore infection will go out. So combined effect is most important, that limits the infection. I have already mentioned in this particular slide that cellular components, particularly lymphocytes, neutrophils, macrophages, and killer cells are important to limit the infection. And there are such a type of inhibitory type of or limiting type of secretions from that of the vaginal columnar epithelium, columnar epithelial cells of the vagina. They secrete alpha and beta type of defensins. These defensins are limiting the infections. So there is a chain and there is a link. Only thing is that this body defense system must be strong. This mechanism must be strong. It compromises because of stress. It compromises because of parturition. It compromises because of heavy infection. And therefore, if we are able to make this particular body defense system strong after parturition, chances of infectious repeat bleeding are very, very less. Progesterone and estrogen. We have to consider the role of estrogen and progesterone because repeat bleeding is a problem of cyclic animals. Cyclic animal. Progesterone will flourish the infection. Progesterone will, yes, go on. It will allow multiplication of organisms. It will flourish the infection. Whereas estrogens, they will limit the infection. A cow, if eliminates the infection before ovulation, then definitely she has a chance to conceive. But if she fails to eliminate the infection during estrogenic phase, there is no chance that this particular cow will eliminate the infection. Means progesterone will favor this. Very, very important that progesterone favors for infection, multiplication of organisms. It provides opportunities for inflammatory condition in the reproductive tract, but estrogens, they limit the infection. Another important thing is that whenever there is infection, this infection will limit folliculogenesis. Infection will limit maturation of follicles. Infection will limit ovulation. So reproductive performance of the animal is compromised because of the infection. And always it is important to consider that the level of these steroids should not make any type of stimulus for the infection. So these are the things as far as our steroids are considered. Considering the therapeutic, considering the pathogenesis, causes, etiology, preventive type of the thing, now every field veterinarian is most importantly waiting for treatment aspect. What is the treatment? Oh, we know everything. We know that, yes, there is an infection. We know that animal is repeating for 10 times, 12 times. But what is the conclusive type of therapeutics that you are interested in? But friends, please remember that this particular treatment should eliminate the microbes so that infection should go out. This is number one. Number two, the treatment which we are going to adopt should not have any type of adverse effect on natural uterine defense mechanism. Never this particular treatment should affect the uterine defense. No antibiotics should continue its existence as a residues in the milk and the meat for a longer time. Immediately within 2, 3, 4 days, there should be elimination of all residues. Whatever chemicals we are using as antibiotics, they should not be irritant to the endometrium. Very important, otherwise animal will suffer with pain. The drug should be easy to administer. Intrauterine, oral, parenteral, that we have to consider, but the simple thing, simple administration is necessary. This antibiotic should not lead to antimicrobial resistance because of low dose, because of the repeated use, because of untimely use of the antibiotics. When those antibiotics which are not at all effective, if we are using such a type of antibiotics, that will lead to antibiotic the antimicrobial resistance. So we have to consider selection of antibiotics, any type of treatment on all these aspects. Route of the treatment, friends, intrauterine therapy was in practice, but nowadays clinicians, they prefer parenteral route. It is only because anything which we carry to the uterus, it can create the problem. It can create. It is not never. It creates. It can create the problem. See, intrauterine is best when we are treating the animals immediately after parturition for 3 to 4 days. Installation of some boluses, nitrofurazone, urea type of boluses immediately after parturition, that is a different. But if we have to treat uterine infections, just like the gastrointestinal tract and respiratory tract, we never install the drugs like this for infectious condition. We go for parenteral route, and therefore parenteral therapy will be more appropriate. Type of the therapy, which therapy we are going to use? Herbal type of therapy is available. Very cheap, very safe, very convenient. There are no side effects for herbal therapy. We can go for herbal therapy to limit the infection. We can use chemicals. Yes, effective type of chemicals we can use for the treatment of subclinical endometritis. Ozone therapy is also not now available. We are going to discuss this particular therapy this week. I'll use antiseptics and antibiotics. We have to use antiseptics, cleaning, sterilization. This is necessary. Environmental infection we have to reduce. We have to keep the cow byres dry. Antibiotic use must be limited, and only effective antibiotics which are recommended by culture sensitivity test, those are to be used. If we have to go for hormonal treatment, the only two hormones are available with us. Number one is prostaglandin, and number two is estrogens. We are going to discuss this. Ecbolics, uterine tonics, these are basically Ayurvedic herbal type of preparations, and they don't have any type of harmful effect on the reproductive tract. Or we can have combination therapy, one from one group, another from another group. Such a type of therapies we can use in case of the animals. Herbal tonics. See, all types of ecbolics which are available in the market, these are called as uterine restoratives, cleansers, and ecbolics. Basically, they are cleaning the uterus. They are draining out the contents of the uterus. Whatever contents are there, those are drained out. And therefore, these herbal drugs, those are given orally, but their effect is on uterus for uterine contractions, and thus they eliminate, or thus they support the elimination of infection. We can use these type of things regularly in case of the animals. Herbal antibiotics, this is the new concept. I have tried at least neem and garlic out of this, and these things, they give results. Never expect 100% result for the treatment with herbal type of therapy. We get 50%, 60% results even with the neem extract, even with the garlic extract, because basically these are having antibiotic properties, and non-specific type of infections can be very well controlled by this. But if the infection is with the mixed type of infection with anaerobic type of organism, then there are problems for curing the infection. Breeding rest. Friends, no one will believe, no one will accept, but it is 100% perfect solution in case of repeat breeder animals to give breeding rest, no insemination. Let animal come into the stress. No insemination, no breeding is to be arranged during the estual stage. This particular stage will help for improvement of body defense mechanism. Blood will come to the genitalia, more phagocytosis, more type of killer cells will be available in the genitalia, more clearance of the infection. Give total rest. Go once again for the second rest, and then definitely animal will be healthy as far as the uterine health is considered. We are regularly using Ayurvedic tablets for cleaning the uterus. And these tablets, they are giving the results. So one cycle rest along with such a type of herbal therapy, this is a combined approach. It gives better results. Lugols iodine, if a doctor uses Lugols, generally the society or the field farmer, they will consider that this particular veterinarian is not a veterinarian of new generation. This is not like that. It is very, very false type of consideration. A veterinarian who is using Lugols with skill, with his experience, definitely he has confidence to cure 50% cases with the Lugols. 3% Lugol solution, diluted one, intrauterine therapy, reduces the infection, and once cycle rest will definitely go for 50% results. No need to go for costlier antibiotics. Why we are preferring the antibiotics of 1500, 1600 rupees per vial? I'm telling about per vial. So forget about such a type of costlier treatment. Go for Lugol iodine. 50% cases will resolve. Next one is the hormonal therapy. Best solution in case of infectious repeat breeding is to hit the animal on day 10th, 11th or 12th day with prostaglandin. On 10th day, 12th day, 11th day, 12th day, go for luteolytic dose of prostaglandin. This will lead to clearance of uterine infection because there will be luteolysis. Animal will come into the stress. Repeated exposure to stress, estrogenic activity will prevent uterus from exposure to progesterone, and thus infection we can eliminate, number one, and number two, we can make the uterus healthy. So prostaglandin therapy on day 10th to 12th is the best one, and we can combine this with other type of treatment, because on 11th day if we treat the animal, on 13th day animal will be in stress, and on this particular day we can use Lugol's iodine, and definitely that will help. Next one is ozone therapy. Ozone therapy is being used in case of pet practice regularly, but in large animal practice we will have to demand this particular therapy because it is a replacement to antibiotics. It cures the infection, it cures the non-specific infection, it cures the bacterial infections, and cheapest way, there are no side effects. And therefore, whatever recommendations are there for ozone therapy, that we should try in clinical cases. The next one is antibiotics. Yes, we will have to go for use of antibiotics in some cases. Floxidine, enrofloxacin, ciprofloxacin, leofloxacin, number of antibiotics of this particular group are useful, and they are reducing the infections 60 to 70%. Please remember, it is 60% to 70%. If we add control of anaerobic infection through imidazole preparations like metronidazole, tinidazole, then definitely this particular percentage will go up to 85%, 90%. But total cure with antibiotics is impossible, and therefore 80% to 90% treatment with that of the combined drug therapy as antibiotics plus imidazole therapy, that will be helpful in case of controlling infectious repeat breeding problem. Immunostimulant type of agents we can use, levamisole, when we are using other type of therapies and we are making the animal immunologically strong with levamisole, injection levamisole will also improve the immune status, and it will help to have better efficacy for the results of other type of treatments. Immunomodulation is the recent concept, and immunomodulation is basically based on infiltration of blood into the genitalia. We want more blood into the genitalia, and that is possible through E. coli polysaccharide, oyster glycogen, autologous plasma. Very simple. E. coli polysaccharide may be costlier one, but why not autologous plasma? We are not trying these type of the things, and if we go for autologous plasma, in some of the cases, definitely it will be helpful. Friends, selection of therapy, cheap type of therapy, result-oriented therapy, it is all depends upon the skill of the veterinarian. Whatever experience you are getting in that particular area will be suggestive for accurate type of therapy in case of the animals. But when you are treating the animals for infectious repeat breeding, please remember that always inseminate, then go for intrauterine therapy after 7 to 8 hours. By that time, all sperms, those will be available in the fallopian tubes. Uterus will be empty with that of the infection. That infection will be cured in 3-4 days. Conceptus will come from fallopian tubes to the uterus. On 5th day, there is a healthy endometrium, and from 5th day onwards, the conceptus will grow. So, before insemination, intrauterine therapy, after insemination, intrauterine therapy, these things we will have to consider if we are going for intrauterine therapy. Best thing will be parenteral therapy, because antibiotics we can use on day 0, day 1st, day 3rd, 2nd, and day 3rd. For 4 days total course we can have parenterally. That is most important. If we go for intrauterine therapy, we will have to go for 0 day and maximum day 1. But that is not possible even in majority of the cases, particularly in case of buffaloes. So intrauterine therapy is once only. Parenteral therapy, we can totally keep the antibiotic level constant in the blood for 3-4 days, and that coverage will limit the infection. Here there are some results. Subsequent stress, if we go for artificial insemination after treatment, this will reduce the inflammatory condition of the endometrium, and therefore our results are 95 to 100%. Please remember, these are the results which we have recorded with our postgraduate scholars. Treatment and insemination protocol will have less success as compared to treatment, rest, and subsequent stress insemination. So always prefer 1 cycle rest in case of infectious repeat breeder animals. Enrofloxacin 20 milligram per kg body weight and metronidazole intravenous, definitely they have results. Cycle break with prostaglandin after complete antibiotic treatment, that will give 90% plus results. Leofloxacin, alpha tocopherol, this we have tried. Leofloxacin, ornidazole, alpha tocopherol, that we have tried here. Vitamin E, alpha tocopherol acts as a cellular antioxidant, and it favors uterine defense mechanism. So vitamin E is always favorable, and we can get the results. One important thing I would like to submit, that if we use EDTA and TRIS, 7 parts of EDTA and TRIS 1 part in 20 ml buffer solution, that also cleans the external genitalia. Earlier, there was a practice to use saline solution, clean the external genitalia, and then go for artificial insemination. Instead of that, if we use EDTA and TRIS, that will give the better results in case of repeat breeder animals. So cleaning of external genitalia and avoiding the risk of carrying the infection from vagina to cervix can be avoided by cleaning the external genitalia, or particularly the vaginal passage, with that of TRIS EDTA combination. Here there are other type of results. This azithromycin and neomycin in combination as a pest which is available in the market. When it was used for intrauterine therapy for 3 days, that has given the results. Lugol's iodine 3%, 4%, 30 ml as per the capacity of the uterine horns, that will give the results. E. coli polysaccharide 100 microgram, that dissolved in 30 ml. 30 ml means as per the volume of the uterus, that gives the results. We can go for Lugol's iodine and levamisole. We can go for Lugol's iodine and vitamin A. We can also go for immunomodulator, E. coli polysaccharide and levamisole. Such a type of combination therapies are possible, and definitely it gives better results when we are using in case of infectious repeat butter anemia. Combination therapies, they will give better results above 80%. Ozone therapy, right? This instrument is costing 20,000 to 50,000. Every polyclinics or every mini polyclinic should have this machine, because this is not only for infectious repeat bleeding, but it is for mastitis. It is for all healing of the wounds. It is post-operative treatment in case of the animals after surgical corrections. We can use ozone abundantly in the clinics, and we should start using this particular ozone. Ozone is an alternative system for medicine applied to increase oxygen level in the body. What we are doing it, O2 is converted to O3, that is ozone. Oxygen is converted to O3, and that is ozone that we are providing to the body. Number two, ozone can act as immunomodulator as well as bioregulator, and shown that it has antibacterial effect. This is most important. It has a antibacterial type of effect. It exhibits multiple reactions and effects on, and if they have, and it has effect like antioxidant property, immune system activation, pathogen inactivation, very important, vascular and hematological modulation, anti-inflammatory. These are the things which are very, very beneficial in the clinics, and therefore infectious repeat bleeding problem, definitely it will have a better success at a cheaper rate, and at an early date we will get the results with ozone therapy. We are at the fag end of this presentation. This time I have tried to manage with 75 minutes. Friends, it is important that our approach must be perfect. We should have clear understanding about the infectious repeat bleeding problem. We should suggest, we should recommend for preventive type of therapies. If a case comes, you will get the case after 5 or 6 repeats. See, patience of the owner is very, very important. If owner is not so impatient, definitely we can go for our logical approach with herbal type of antibiotics. We can go for Lugol's iodine therapy. We can go for prostaglandin therapy. We can go for breaking of the cycle, and also we can go for improving the immune status. Use of the antibiotics. There are n number of things which are available for ready to install intrauterine, but that will also not give us the results. We will have to go for combination therapies, and particularly for aerobic and anaerobic type of organisms. So always prefer antibiotics along with the imidazole group. Antibiotics parenterally, imidazole intravenous. This combination will go for better type of results in case of the animals. And whenever there is opportunity, pursue for making ozone therapy available in the clinics. Use it yourself so that you will be able to treat the cases, and you will build up your confidence. Definitely this will reduce the incidence of infectious repeat bleeding problem. Friends, in last 35 years, I am regularly and daily attending minimum 12 to 15 cases of repeat bleeding on call. And I am getting 70 to 80% success rate after 1 year. So if you are treating the cow today, you will get the positive results after 1 year. When the cow will parturate, owner will report you that yes, last time you said that this is the line of the treatment in case of repeat breeder animals, and definitely that animal conceived. Now this animal is showing some problems. So whatever the last time you have given your advice, professional advice, definitely that has credit, and that is really economic type of benefit to the farmer breeder. So I think I have justified this particular topic, and I'm available for you all with my email address, and this presentation will be available for you all every time. Yes, we can go for some questions.
Thanks a lot, sir, for a very informative session. And I think we have all the ideas cleared from all the dimensions about the causes of infectious repeat breeding as well as the different treatment protocols. We are thankful.
Thank you, sir. So the question was, if the discharge is turbid, is there any chance of pregnancy? Observation, and that too visible observation, has no standard as far as the clinical diagnosis is considered or fact findings are considered. Friends, please remember that discharge we will have to send to the laboratory to check whether there is any type of positive agent bacterial contamination in the discharge. Color can get changed to some extent, and therefore turbidity we cannot link directly that this is the case of infectious type of repeat breeding. Dr. Arif ji, are you satisfied? Hello.
Yes, sir. Thank you.
Okay.
Thank you, sir.
Sir, Dr. Naveen has asked, sir, could we use any antibiotic just before AI?
Yeah.
So I think you have explained, but once again.
Yeah. It will be better, doctor, if you go for antibiotic intrauterine 6 to 8 hours after insemination. By that time, within these 6 to 8 hours, maximum number of motile, live, and mobile normal sperm, they will reach the fallopian tubes. Now uterus is empty. At that time, you inject install antibiotics in the uterus. It will take 3-4 days to cure the uterine infection. By that time, the conceptus is available in the fallopian tubes, and it will come down to uterus by day 5th or the 6th. So that will be correct approach.
One more question from Dr. Naveen only.
Yeah.
Sir, I have read that betadine impairs the leukocyte function in high concentration. What concentration of betadine should we use?
See, povidone, iodine, betadine, these are the basically antiseptics. We are not going to use it intrauterine. For cleaning of external genitalia and particularly the vaginal passage, a mild form of betadine we can use. It will be better if you use lugol-iodine, doctor. That will give us the results. Betadine, we are not we cannot prefer betadine for intrauterine use. So prefer lugol-iodine, that gives much better results than betadine.
One more question. Is flushing of uterus before putting the antibiotics is recommended in cattle as in horses?
No, not at all. Not at all. We never go for flushing.
So next question is, sir, after parturition, at what day the prostaglandin should be given? He means first injection after parturition.
Yeah, very good question. I told that those animals which are more than 500 kg, their uterine bag will be of 500 to 50 kg to 70 kg, and the calf size will be something like 40 kg to 60 kg. Such a type of huge bag needs to be collapsed immediately, and for that purpose, first 3 days, 0, 1, 2 day, go for estrogenic preparations, very mild 2 to 3 ml intramuscular, that 10 milligrams each ml it carries, that will collapse the bag. and thereafter you go for prostaglandin. Prostaglandin 2 ml, 2 ml for third, fourth, fifth day. That will collapse the bag. Only thing we are going to increase the uterine contraction for collapsing of the bag. We are not going to have any type of expulsion of uterus with this small dose. We don't want it. Yes, there was one question. I
Thank
think.
you, sir. No, there are some more, sir. At what days we should do rectal to record involution of uterus?
Yeah, 30
And
days. I
again,
said 30 days because in some buffaloes it is 100% 30 days, but in HF and other say exotic animals it is up to 35 days. 30 days is a general term I used for complete involution of the uterus.
right. And again, he has asked one more question, that what drugs should we use to make sure proper involution? You have answered it, but we'll request to explain it again, sir.
Total preventive protocol. I am using it since last 20-25 years. I have that type of WhatsApp message. Just I am putting to the concerned farmer breeder. But friends, please remember, even if we are using it regularly under Indian conditions, when I was in Australia, I was told that not a single antibiotic is being used after parturition for controlling the infection in parturated cows yielding 100 liters of milk per day, average milk. They are controlling the infection only with sterilization practices, these disinfections and everything. Not a single cow is treated with antibiotics. Immunity care is taken up by other means, not with the antibiotics. So we will have to reach that particular stage within the next few years.
Yes, sir. Sir, Dr. Rushikesh has asked importance of Baseline in repeat breeding.
Brucellin, Buserelin.
Yeah.
No, that is only for non-infection. That is for non-infection. And there was one question: should we go for artificial insemination to the first estrus? No, never, never. Artificial insemination is recommended for regular estrus. First estrus is first estrus. Second estrus is regular estrus, and it is regular because it is exhibited after 21 days. So regularity is explained with this 21 days period, and therefore second estrus is the fit estrus for artificial insemination. First estrus has no regularity. We don't know whether there was whether earlier there was any estrus. So in case of cows and buffaloes, first estrus is examination estrus, investigation estrus. We have to monitor total duration of that estrus, and we have to monitor the type of the discharge of that particular estrus, leave that animal and go for insemination to the subsequent regular estrus. If first estrus is contaminated with turbid discharge, go for the treatment. Farmer may have a chance to treat the cow, and cow may have a regular healthy estrus, subsequent estrus.
Sir, I think the idea of using antibiotic, intrauterine antibiotic after AI has fascinated many. So there is a question, which antibiotic should we can use after the AI?
Antibiogram is a term, doctor. The antibiotic which you are using in your local area, where you are getting best results for all type of infections, that is the best one. I go for enrofloxacin, I go for levofloxacin, and I'm getting the results. That same story will not be effective in all places. This is very, very important. So you can have antibiogram, or you can go for test samples for this culture and sensitivity. Get the confirmation and you go for any type of antibiotic.
Can we use acriplavine for IU? If yes, then at which concentration?
Same thing, antiseptic. It is used as antiseptic, and all antiseptics are to be used for external use only.
Right, sir. So Is it advisable to go for AI at first? Oh, sorry, this has been covered. So I think, sir, somebody has asked, please discuss the treatment of fibrosis of cervix and uterus. How much rest period should be after the treatment of fibrosis?
See, fibrosis will occur in dystocia cases, and those cases which are suffering from fibrosis, that means definitely these cases they must have suffered from some type of infection, cervicitis earlier. This rigidity of the cervix will be limiting for passing of the gun at the time of artificial insemination, and it is always better to go for epidosine a day before of estrus, day 2 before estrus, for slight dilatation of the cervix. In case of cows and buffaloes, cervix is fibroelastic. It is fibroelastic, and therefore this fiber contents, we cannot reduce it to maximum extent, and therefore logically we will have to slightly make them elastic with the help of epidosine, which will form some lumen in the cervix, and thereafter we can go for AI. Thus, we can go for the successful type of pregnancy in case of fibrosed cervix.
Sir, namaskar.
Namaskar.
What is the dose rate of estrogen and at what time it should be given? Whether it will affect on letting down of milk?
Yeah, you are very correct, doctor. Actually, our purpose for using this estrogen is to collapse the bag. Slight uterine contractions, this we can have with 20 units of this milligram of estrogen. 2 ml, that will be sufficient for first 3 days, and that is followed by prostaglandins for 3 days, next 3 days. So all countries where the high yielder animals are there, they try this type of therapy for collapsing of the bag. Otherwise, if the cervix and the bag remains dilated one, if there is accumulation of air in the bag, there are chances of infection. We don't want chances. This also you can have the use of oxytocin, but oxytocin is always a vibrant type of a hormone, and it gives very strong type of response of the estrogenic adder, and therefore if we go for estrogenic preparation, definitely that will be useful.
I think all the questions has been covered. So we are very thankful to respected Markandeya sir for very informative and very important session. We all understand that reproduction is the backbone of the dairy industry, and dairy industry is actually the key for rural economy in many parts of our country. So we are very thankful for giving such a valuable time as well as a valuable guidance. Respected sir, we are thank you, because whenever we request you, you are always ready to guide us. And again, I am also thankful to Jiva Go Samruddhi team for providing the platform for this meeting. From on behalf of Mahavet, I am very much thankful to all of you who has participated in this meeting. And again, once again, I am thankful to respected sir as well as the team Jiva Go Samruddhi. Thanks a lot.
Thank you, sir. Thank you very much. Thank you, everybody.